Good morning again. So I'll be presenting a case in which we performed a modified photodynamic therapy for the management of Juxta-Papillary Capillary Hemangioma. She was again a 52-year-old female with chief complaints of decrease of vision for 1 month. There was no relevant systemic history. Best corrected vision was counting fingers at 1 feet, and intraocular pressure was 17 millimeters of mercury. There was no abnormality seen on the slit lamp examinations, and there was a pupillary defect present. This was the fundus picture. The right eye was absolutely normal, whereas the left eye showed around 4 disc diameters of mass sitting right above the optic nerve head. And there was an associated exudative RD, which was extending up to the fovea area and decreasing the vision of the patient. The B-scan ultrasound again showed the mass was about 10 millimeters to 4 millimeters in size. And this was the FFA, and just note, what we noticed was there was a rapid filling of the mass with the fluorescein dye, and this fluorescein dye started emptying as soon as 1 minute, and by the end of the fluorescein, all the dye was emptied from the tumor. The Doppler ultrasound is a confirmatory test for these hemangiomas, like you see an increased blood flow inside the tumor with the Doppler ultrasound. But the question was, because the dye was, the juxtapapillary capillary hemangiomas are angiomatous hematomas, and they can be seen sporadically, as well as 6% of von Hippel-Lindau syndrome cases, and 65% of them, if left untreated, progress to complete visual loss. The indications of treatment include macular edema, serous retinal detachment, vitreous hemorrhage, tractional detachment, or lipid exudation. And the treatment modalities include laser photocoagulation, cryotherapy, radiation, transpupillary thermotherapy, or photodynamic therapy. But the question was, if we perform photodynamic therapy, we were not sure how much long the dye will last in the tumor so that we can get a good effect of the photodynamic therapy. So we just modified the photodynamic therapy. We did a faster infusion with the infusion time of just 5 minutes, and we did an early initiation. Just 1 minute after the infusion was finished, we started the laser treatment, and we used it for a longer duration, that is about 166 seconds. So this was 3 months post-PDT. The tumor has regressed, and you can see it on FFA. The tumor has regressed, and only a small complex of vessels has been left. This is 3 months post-PDT. On Doppler ultrasound also, there is low blood flow seen on the optic nerve head after 3 months. And this is ultrasound, also shows the decreased size of the tumor. Thank you.